I'm really excited to have you on the podcast today. I really want to dive into this topic of health issues and medical reasons and justifications for restriction and an abstinence approach. But before we get into that conversation, I would love to learn a little bit more about you and your journey here. So, you're a registered dietitian. I've had quite a few on the podcast before. And something that seems to be a common thread amongst them is that their education was really weight centric in school and their training was weight centric. And then they have, through whatever path, however it unfolded for them, have found their way to the anti-diet space, the intuitive eating, the weight neutral approach. So I'm curious if one, was it like that for you? And if so, two, what was your journey to becoming the dietitian that you are today?
Yeah, it's funny. I definitely think my story aligns with that with that mold very much. Um, it's funny too though, because I've talked to some RDs that have become dietitians more recently than I have, who are I'm starting to hear like little bits of like, oh no, like I knew about intuitive eating and health at every size, and that's why I went into the work. And I'm like, oh, that's so cool. But yeah, I could definitely share kind of my journey. So my education, like you said, very weight centric, very much like aligned with diet culture in many ways. It was, the whole like you're going to help clients lose weight background was kind of embedded into the program that I went through. Yeah, and then I guess like from there, I went on to get my master's and did the whole dietetic internship thing all the while like yeah, I was like doing something very supportive. I always tell people like I remember very vividly in my education thinking like, yeah, like diets don't work. Like that's not like, kind of like rolling my eyes at family members that were doing diets, which is so interesting to me because I really felt like I was almost like quote unquote anti-diet in that way. But what I didn't realize was all of the subtle, nuanced, tricky, sneaky ways that everything that I was like engaging in and everything I was kind of promoting was still aligned with diet mentality. So that's always really fascinating to me. But yeah, so I got my master's. My first job as a dietitian was in a bariatric surgery clinic, a weight loss surgery clinic, which again, super wild given kind of the path I'm on now. But I feel like that really positioned me for when I first learned about health at every size and intuitive eating. And it not only resonated with my own disordered eating history and struggles around food and body, but it also aligned with the stories that I was hearing from, the patients sitting across from me who were in larger bodies and kind of really in the depths of diet culture. Like I really feel like weight loss surgery, bariatric surgery, in my biased opinion, is like the heart of diet culture. And they were really, really struggling. So it positioned me so when I first learned about health at every size and intuitive eating, like it just instantly like clicked. So from there, I kind of like did this weird shuffle of like, all right, well, like maybe I can like integrate these concepts into my work at this bariatric surgery clinic until I hit the point where I was like, yeah, no, this is not, there's no way to integrate this here. And it doesn't feel ethical for me anymore. And that's where I really kind of like went a different way. And I know the topic we're going to talk about today kind of actually aligns with where I went next, which was into working with clients at a dialysis clinic. So folks on people that have to, adhere to these very rigid diet guidelines. And for me, it's interesting reflecting back, but for me, I was like, this is, certainly more aligned with, what I want to be practicing than where I was before, but it brought these new really difficult challenges in how to like bring intuitive eating and that lens into that work. So yeah, that's a little bit about like my path. And then, from there, I ended up jumping into kind of like an eating disorder program for a year or so while I had been building up my own business the whole time. And then just in the past like 6 months, I took the leap to fully doing this work for myself.
Oh, well, congratulations on having your own private practice. I don't know if you call it private practice, but your own business, you know, and your own
Yes.
offering and being a full-time entrepreneur. That's awesome. So congrats there.
Thank you. Yeah, it was a very exciting leap and terrifying leap to make.
I'm sure anyone who's ever made that leap can resonate. I know I certainly can.
Mhm.
You mentioned a couple of awesome, really important terms and some situations that you have been in that I'd love to go a little bit deeper into. So the first thing that you had mentioned in the beginning, when you were talking about how like diets don't work, but you weren't really aware of the subtleties and the sneaky ways in which the diet mentality pops up. So what is the diet mentality? Like, what exactly does that mean? And how can you still be dieting without being on a diet like Weight Watchers or Atkins? You know,
Yeah.
what does that look like in action for somebody?
Yeah. So, I mean, the way that I think about the diet mentality, kind of first, there's a few different points, but like the first thing comes to mind is it's based in something external to yourself. So it's like, it's not making a choice from like, I always use the example of like, okay, like it's like 9 p.m. at night and like I'm hungry. Am I going to honor and listen to the feedback my body is giving me, which would be very intuitive and aligned, or am I going to listen to some external rule about whether or not I should eat at that time or what I should eat at that time or whatever? So diet mentality is external. It's not based in your own internal experience. It's based in what someone else somewhere else told you to do. And again, that doesn't have to be a diet plan. It can just be these like tiny little food rules you picked up along the way and didn't even realize you were still doing. That's what I see over and over with my clients. So like, I didn't even realize I was doing this, but I totally am. So that's just like one example. So it's external to you. The other big one, of course, is that it's based in trying to change the appearance of your body or the size and shape of your body in some way often, right? Like that's kind of like another integral part. You're making a choice based on hoping the outcome or assuming the outcome will be a smaller version of you. So how can you not be on a diet and still be in this diet mentality mode? Again, like I see it all the time. I see it all the time with clients coming to me and they're like, I don't really resonate with like, you know, chronic dieting or, you know, having dieted a lot, but I've been in this place of trying to control my body and trying to control food for as long as I can remember. So again, you can have just like all of these subtle little rules that are guiding your choices with the end goal of changing what your body looks like, without following some like rigid plan that has like a name.
Totally. So it's a way of thinking that is rooted in food and weight control.
Yep,
Yeah. Yeah. And
that's it.
like trying to be good. Like this food is good, this food is bad. Or like I shouldn't eat before a certain time, or I shouldn't eat after a certain time. And these ideas can be picked up from social media, friends and family, past diets that you've been on, and they sort of just become your way of thinking.
Totally. Another thing that comes to mind as you were talking there is like oftentimes it's very black and white. It's a very like all or nothing, like this food is good, this food is bad, and like this food is going to lead to weight gain, this one's going to lead to weight loss or whatever, right? It's very black and white, all or nothing.
Yeah. And I think that that way of thinking is how a lot of people operate now, since like dieting has kind of become like a dirty four-letter word. Like, I'm not dieting, it's a lifestyle. What are your thoughts on that perspective?
Yeah. I mean, it's so interesting to me because I feel like there are still like I have said that a lot myself, and it's totally true. But there are still these like pockets, whether it's like cultural, but these pockets where like dieting still is like totally active and like that word doesn't necessarily resonate or like bring up a bad thing. But then I think in more mainstream culture in recent years, it has very much become like, you know, don't go on a diet, like whatever that is. Like it's just like it's not cool, it's not going to work long term, but do all of these like lifestyle changes. And again, if it's still rooted in this assumption that your body size or shape will change or appearance will change, right? Maybe it's not so much at the forefront of like lose X number of pounds in X number of days because it's not as cool to put that at the forefront, but it's very much the assumption of like, if you do these things, you will be smaller, obviously, because you'll be healthier. And the underlying assumption is healthier equals smaller. But again, if these lifestyle changes, quote unquote, are still rooted in these external rules and rigidity and restrictions, like it's the same exact thing, just in a different shiny package.
Again, still focusing on that assumption that like weight loss is good and that weight loss is the goal, and black
Yeah.
and white thinking. Some foods are good, some foods are bad.
Right. And restriction and deprivation, right? It's like, yeah, like just do this lifestyle change of like not keeping these things in your house anymore. It's like, okay, that's dieting, that's good bad food mentality, right? Like same exact thing.
Mm. And so when you were leaving, like when you were in this bariatric clinic, so I'd love to go into that a little bit deeper. Something that I have heard from people in the online space has been, well, I had bariatric surgery and now I'm binge eating, or I had bariatric surgery and now all the weight is coming back. Can you speak to people's experiences like that?
Yeah, absolutely. Where to start? So I mean, first of all, I guess with that last piece, like I think something that people don't realize is how very, very common it is to regain weight after bariatric surgery. Um, it is, I mean, I view bariatric surgery, and I don't think it's a stretch in any sense of the word, as like a traumatic experience to your body. Like your organ is being partially amputated, a perfectly healthy organ, and then you're not able to get in the nourishment that your body literally needs to survive, so it does all these crazy adaptations. But in the short term, in that like acute trauma period right after the surgery, a lot of people lose a lot of weight, right, in a really damaging, scary way for your body. Some people don't, by the way. Like there's actually a really good chunk of people who don't lose that weight, and then they're blamed because it's like, oh, you must not be like following the diet well enough. But maybe your body is just doing a really good job from the get-go of protecting against that weight loss. But a good amount of people will lose weight really, really quickly. And so it looks like it's like this like weight loss success thing, quote unquote. But in reality, it just takes a while longer for your body to like gain some momentum in kind of regaining that weight and getting you back to a place that it feels is less threatening and yeah, more thriving, more surviving. So again, I guess the long and short of that is like most people will regain weight after bariatric surgery. It just is probably on a longer time frame than probably every other diet thing out there, or every other like weight loss thing out there. There's not, I mean, there's more and more kind of long-term evidence coming out, but there hasn't been a ton of long-term research with weight loss surgery, which is part of the reason that this is tricky. And I think part of the reason for that is because there's so much pressure, this like individual pressure on bariatric surgery patients to like be successful. And it's really, again, put all on them of like, if you just like do all the things, you'll be successful. So if you were looking at a long-term weight loss or a bariatric surgery study, those people probably are not going to come back to their doctors and report like, oh yeah, like I've regained weight or whatever, because they're going to be embarrassed and feel like it's their fault. So it doesn't make for like really great long-term research. So yeah, that's that piece of it. In terms of like the binge eating, I mean, I think there's a good amount of people who prior to weight loss surgery, again, certainly by no means all, but there's a good amount of people who have struggled with binge eating or overeating or behaviors before surgery. So it just, the behavior changes after surgery, and that again, for many people, they can't eat the same amount maybe, but binge eating in my mind, it's not about the amount of food, it's about the chaos, the out of controlness, and like the I'm not stopping until like, you know, it's really kind of this like desperate need to stop situation. So that still comes up for people after surgery. And again, if you think about like this acute trauma in which your body is not able to get the nourishment it needs, it's going to do whatever it can to convince you to eat more, even if that kind of results in like bingy behavior. Like that's actually really an effective way of getting you to eat more. It's probably going to look like grazing and like constantly like wanting food. Also, something I've been talking about a lot recently, it's probably going to look like a lot of mental hunger and things that bariatric surgery clinics often, you know, what's the word? They kind of like say you should avoid, right? They say like push back against the mental hunger. Like it's just mental hunger. It's not physical hunger. Well, guess what? You just amputated the organ that's supposed to tell you that it's physically hungry. And now like it doesn't know how to do that. So the only way it knows how to tell you is by making you think about food like all the time. So like that's actually like what it's trying to do to tell you it's hungry.
Yeah, and that's common, I think, with restrictive eating disorders as well, as you get mental hungry, like you're thinking about food, and that is very often one of the ways in which your body is trying to tell you that it's hungry. And they talk about this in intuitive eating as well. If you start thinking about food, it's very likely that that's one of the ways your body is communicating hunger to you, its need for nourishment.
Totally. Yeah. I think there's no going wrong with honoring that mental hunger, right? Like it's very likely, like we're saying, like it's very likely a sign of hunger and your body didn't know how to tell you, or it's a response to deprivation and scarcity and restriction. And the way that you're going to get on the other side of that is by honoring it and moving through, even if it's not true hunger. Like you still need to honor that to get through the deprivation and scarcity.
Which I imagine is so challenging when you've spent years in a body that's been stigmatized, and you've just spent all of this time and this money and this energy going through and getting this, like you said, like traumatic surgery of amputating a healthy organ. Like you've just gone through something very significant, thinking that it's going to support you in weight loss. It's going to support you in changing your health. It's going to support you in changing how you feel about yourself. And then not only are you probably continuing to struggle with the diet mentality and continuing to struggle with that mental and emotional restriction and deprivation, but now you also have very real physical deprivation, potentially not being able to meet your body's need for nourishment because your stomach is smaller. And I don't actually know if there's any truth to this. Maybe you'll know, but if your stomach is smaller, is it more difficult for the body to assimilate nutrients from your food? So that could be leading to you wanting to eat more. I just could imagine somebody in this position, like just how overwhelming, how defeated, how scared, how hopeless they might feel if they're struggling with binge eating after this surgery.
Yeah, I think you articulated that all like super, super well. Like it totally is true. It is like they've been fed this story. And again, that very much like if you try hard enough, like this will be like this magic thing for you. And like that's really sad that it's kind of been a lie and really like isn't going to address those core problems that they have, certainly not in the long term. And yeah, to speak to your like, yeah, like the piece about like your stomach being smaller and less absorbed, like there's going to be less absorption of nutrients. So certainly it's not even just like that you can't get all the food in, but your body can't utilize the food that you're consuming as well. And certainly like for folks who have had this surgery and specifically like gastric bypass, that's even more intense and there's less nutrient absorption. Maybe you're having things like dumping syndrome. And like if stuff's moving through you that quickly, like with dumping syndrome, like like there's no time for that absorption to happen. So yeah, it's really kind of at all angles this malabsorption is going on.
Just for anyone listening who doesn't know, I'm assuming dumping syndrome just sounds like the body just like sort of like evacuating the food really quickly.
Yeah, exactly.
Why do you know what? Sorry, go ahead.
Yeah, it's specifically with like very high sugary type things, sometimes like high fat things. I honestly can't recall the logistic behind it right now, but I know it's something about like the way that like it like quickly shifts like your blood sugar and stuff like that, that it just like affects your new organ that way or your new system.
Okay.
Yep.
Thank you for sharing all of that. So I'd love to now shift into when you went into this dialysis clinic. What was it like for you there? And you said you started really like noticing how you could potentially incorporate this intuitive eating, health at every size approach with these restrictions for medical reasons. Just what were you seeing when you were there? What are you seeing now as it relates to people feeling like they need to restrict, or sometimes very much do need to restrict certain types of foods, but are struggling to do so? Like, what can you speak to? How can you speak to those things?
Yeah. So, I mean, the place I was kind of coming from when I made that transition into dialysis was like, again, it was like, I was so like fiery and passionate about like helping people on their relationship to food and like honestly like giving up restrictions and like doing the intuitive eating thing. So like I did everything I could to like kind of like bring that into the dialysis space. But again, like in retrospect, it was like probably one of the hardest populations I could be kind of like trying to bring that to. Not to say it cannot be done or it shouldn't be done, but it's just funny to reflect. I'm like, oh, this was like a very restricted population. So yeah, when you are in that case, like when you're on dialysis, like you have chronic kidney failure for the majority of the patients there. There are just certain foods that are going to spike your level of certain like things in your blood that you have to be careful around, that literally can like be deadly if you consume. And it's not like anything like it's things like tomatoes or potatoes, right? Like it's like certain things, like just kind of random things that also are like pretty ubiquitous, that are like pretty tricky to avoid. And in those two examples, like things that for a lot of people it's like it's cultural food for them, like they've eaten this their entire life and it has a lot of sentimental value. So really, really tricky stuff. There are like some medications that they can take to help with managing the levels of these things while having small doses of those foods, but they have to be really, really careful. So yeah, I guess the way that I kind of, I think the way that I brought this kind of framework to this population was, first of all, being the least restrictive that we possibly could. So again, this can be brought out to other people in other situations that are having to follow some restrictions to manage medical conditions. Like, what is the least restrictive you can be? Like, can we get away from that like all or nothing black and white thinking of like, okay, I guess I can never eat bread ever again. Obviously there are extreme cases where like people really do have to be that rigid, but for most people there's a spectrum and we can figure out ways to kind of find the middle ground that makes sense for you. So the least restrictive you can possibly be. Another thing that comes to mind is, how can we prioritize satisfaction? So if we can't have the potatoes, or we can't have a lot of the potatoes, maybe when we do enjoy the potatoes, the small amount, we're making it in our favorite way, like we're adding in other things that we really, really enjoy, or we're finding things that maybe are like provide similar satisfaction to meet that need. Yeah, so I think prioritizing that satisfaction is really important if you're following restrictions. Yeah, the other things I think of, so this is something actually that I think is really important. So if I'm going to kind of like integrate this again into like other people's restrictions, but coming at it from an empowered mindset. So I always talk about, obviously like very much integrated into the intuitive eating principles, like this idea of permission, like this full permission to eat. And this doesn't change when you're following some sort of restriction. We still need to come from a place of, I have full permission to eat as much of this as I want to. What am I going to choose here, right? If you're coming from that place of choice and saying like, I don't want to feel that way, or I don't want to, affect my long-term health in that way, whatever, like coming from that place of choice, I think really changes how people show up to those decisions, versus making a choice from, oh, I really want that, but I shouldn't, I'd be bad if I ate it. I can't. It's like, no, you can. And what choice are you going to make? So again, it's just a kind of a perspective shift there.
Right. And which might sound small, but I think is massive, massive. Like, especially if you are a recovering dieter, or you're in the process of realizing you have a disordered relationship with food, if you are realizing you're struggling with binge eating and you've tried to solve it through restrictions, and you're coming to this work now, or you're hearing this for the first time, that shift, that fundamental shift of all foods fit, I have unconditional permission to eat, like that is a very different psychological process. I think it impacts you mentally and emotionally and physically very differently. And I love the word choice that you used, of really getting to this place of being able to make an empowered choice to eat it or to not eat it. Because so often, especially for the recovering dieter, we're operating from the place of, I can't eat this, I shouldn't eat this, I'm a bad person if I eat this, and then if I do eat it, I feel even worse, and so I just like end up eating it out of shame and like, fuck it, I'll start over tomorrow. So when you get to that place of like I can eat this. And often people are eating things that they're telling themselves they can't be eating. So the narrative of I can't eat this is a lot like you're lying to yourself. Like you can eat it, you are eating it, right? You're putting it in your mouth. And so getting to that place of like, okay, I really got that I can eat this. And I am fully aware of the consequences. Maybe some of those consequences are physical for you, right? Like if you have blood sugar sensitivities, whatever that is. But it's, do I want it? Like, do I want it? Is the potential consequence worth it to me?
Yep.
And sometimes it will be. Sometimes you're like, I really do want to eat this cake. I really do want to eat this pizza. And yeah, I'm going to feel sick for later. Or I know that, you know, I'm going to maybe have to add in some other health promoting behaviors to sort of balance out the potential impact that it might have on my body. But getting to that place, if I can eat this, do I want it? Yes or no? That is a very big shift away from the diet mentality, like life-changing shift. So it might seem small, but it's, and sometimes that can take a lot of work to get to that place too, because body shame, weights, you know, like the fear of weight gain, getting to that place, people can have a lot of resistance and fear towards it.
Yeah, totally agree. I know. And it's like, yeah, it does sound super simple and it is simple, but it's like so impactful. But I'm glad that you bring up that it's like, yeah, there can be a lot of restraint against making that choice. And like, especially like if you've had these beliefs ingrained forever and ever and ever, it's like just because you hear somebody say like, oh, like you can just choose to have it, doesn't mean that it's going to be like an easy thing for you to do when that belief is still ingrained. One other thing I wanted to mention just as you were talking is like oftentimes like there needs to be this healing phase. Like I think about it in the big picture of intuitive eating in general. People think like, okay, I'm gonna go from like restrictiveness to like intuitive eating and it's all just gonna like work out super well. And in like, yeah, but there has to be this like middle ground of like healing from the restriction. And in the case of this, like it's like we need to heal from all of this scarcity and deprivation and like severe restriction and like I can't have it mentality before getting to a place where you're going to make more aligned choices that feel really good in your body most of the time. There's going to be this middle ground of, okay, now I need to like really lean into full permission with this and say like I really can have it and like really eat the things. And maybe that physically doesn't feel super great in that interim time, but that's, you do that so you can get to the other side where you're making those aligned choices more of the time.
Yeah. And I think that it's when you work through that mental permission piece. So like you said, you're giving yourself full permission. You are maybe eating a lot of the foods that you've typically shamed yourself from, which has resulted in sort of this rebellious type of eating, but working through this place of, I'm allowing myself to eat this because I'm working on healing. Again, that's a different mental and emotional approach, and being able to work through that shame and really allowing yourself to be with maybe the physical implications of that, like you feel sluggish or bloated or whatever, so that you can actually get to that place of, do I want to eat this? Yes or no? How is this physically going to make me feel? And I get why when people hear like eat whatever you want whenever you want, they just experience chaos, like imagining the chaos. But what's really interesting is when you do become more in tune with your body, like you said, you make these more aligned choices. You're like, yeah, I really get that I can eat this right now. Like I get that it's Monday morning and I really could have pancakes. And yes, they sound delicious. Would I enjoy them? Yes. And I also know that that might impact my blood sugar. And I have a podcast interview with Kirsten and I have X, Y, and Z. And so I want to have some more foods that are probably going to make me feel more energized, more clear-headed, not spike my blood sugar. It's like, that's really what we're after, not a disregard for your physical well-being,
Totally. Yeah. I feel like when there's that, like, this would be good if I made this, or this would be bad if I made this choice, that's going to be like your first stopping point. And it's like, if this is bad, then it's like the rebellion thing is there. But if we can like remove that, that's when we make the choices that like feel the best in our body. Also, I just wanted to say that I think, the reason that we have this like vision of what's going to happen when we allow all the foods and it's going to be chaotic is because Probably it will be. And also because every experience that we've ever had with going off the diet and just like allowing ourselves other things has been super chaotic because it's been a direct response to the restriction we've experienced. So like, yes, that will happen, but you have never kind of continued going down that path because you always return to the restriction and like rewind the whatever. Like you know, you kind of like set it up to all happen again. But if we kind of keep moving forward and don't return to the restriction, that's when we move out of the chaos.
Yeah, totally. Totally. So we've been talking about restriction in a general sense. We've been talking about restriction from the perspective of taking care of your health. I'm curious, and if there's no more to add here, no worries. But if someone has a genuine health concern, so like I feel like PCOS is really common, I feel like diabetes is very common, or like, oh, it runs in my family, and someone has been told to take the abstinence approach, the restriction approach, which I feel like is very common in our health care culture, but it's also very common in diet culture. And they've been told they need to remove food to manage symptoms, but they're finding themselves continually binge eating on these foods that they quote shouldn't be eating. What would you maybe say to someone specifically in that situation?
Yep. So, one thing I will start by saying is that, again, our medical system is within diet culture, like all the rest of us. And that like jump to like remove things and like black and white thinking and like just don't have all these things is a really common tactic and like usually not entirely necessary. So, and I know that's kind of a hard thing to say because it's like, oh yeah, just like disregard what your medical providers are saying. That's not what I'm saying. But I am saying that like they have a tendency to like go to the extreme of the restrictions and like further along than is needed. So like maybe getting other opinions, like seeking out support from maybe a diet, like a HAES dietitian or another clinician in this space that like might help you to be less restrictive. So again, it's like, what's the least restrictive option here? Another thing I'll say is like, I guess it's kind of in a similar zone, but like with things like PCOS and diabetes, I'm not like a specialist with either of those, but I do know that there are many non-restrictive ways of managing those conditions. So not only are there like, not only do providers often jump to like restricting like the most restrictive option, but also like these things that don't need to be managed with restrictiveness, are kind of being applied there. So let's use the example, I guess, of like celiac disease, right? So something that like people who have celiac disease need to abstain from gluten 100% if possible. Like when they have gluten, it really like damages their intestinal lining and like has these long-standing effects. So in that case, like restriction from gluten needs to happen. So if you're in the boat of like needing to follow that gluten-free diet for that reason, and you're binging on gluten-containing items, again, a couple things would come to mind. If you're binging on those items, especially in this case, it could be the case that you're not getting enough carbohydrates, right? Maybe you like moved into a gluten-free diet, which also led to you having less carbs because gluten and carbs often go together, but not always. So maybe we need to like be more intentional about getting you adequate carbohydrates throughout the day, not just like at some meals. So that's like one thing that comes to mind. Another thing that comes to mind is like, can we find gluten-free alternatives that will meet the same satisfaction needs, like gluten-free bread or gluten-free cookies or gluten-free pasta or whatever? I do hear that like maybe you haven't found some options that like are as satisfying and delicious as the gluten-containing ones, but that's a separate conversation. But like, can we try to prioritize satisfaction with those choices? So those are a couple things that come to mind with like something that needs to be restrictive. But again, I also think about the mindset thing of like coming from an empowered place of like, I can eat gluten-containing pasta as much as I want, but I know that this is how it's going to affect my digestive tract and this is how I'm going to feel after. Like, what can I do for myself to best support my body that will feel better and take care of myself in the long term?
Mm-hmm, mm-hmm. And is there a different response for somebody who is managing PCOS and diabetes? So I get that it might not be your specific zone of genius or where it is that you practice, but from a health at every size approach. You did kind of mention like taking a less restrictive approach. You also said there's ways of managing it that aren't about restricting food. So what are some of those other behaviors or tools that somebody could add in to help manage restriction that isn't about taking away certain types of foods?
Totally. So I'll use the example of PCOS first because I have less experience there, and I'll go into diabetes. But PCOS, so I just know that the way that it's treated for many people is like have less like carbs and stuff and like whatever, like you have to like not have sugary things, and like that is just not supportive, because likely what's going to happen if you try to restrict carbs with PCOS is you're going to be driven to carbs like in some like crazy maniac type way, because your body has a stronger reaction to not having enough carbs. So anyone that tries to restrict carbs is likely going to feel crazy, but it's even more so if you have PCOS. And this is one of the main ways that people learn to manage PCOS. So that is just like horrifying in so many ways. Again, I will say with PCOS, I don't have a lot of like intricate answers into that, but I think having consistent carbohydrate intake, which is something I would say for diabetes as well, can be really helpful, because your body needs to know that it has access to that sugar coming in, and the way that you're going to do that is by having carbs throughout the day. Certainly like things like movement will help with PCOS, and I know that there's a lot of like supplements, but again, I'm not super knowledgeable in that area, but like adding in supplements, adding in hopefully joyful movement, adding in more meals and snacks with carbs throughout the day would be helpful and supportive and non-restrictive. With diabetes, again, it kind of mirrors PCOS in that we want consistent carbohydrates throughout the day. We probably want to pair our carbohydrate things with another non-carb thing like protein or fat, right? So we don't want to just have like a piece of bread in the morning. We want to add like some avocado and some eggs and like some other things to help our body not spike the sugar, but instead like slowly digest it. So adding in kind of like that food pairing type situation, having more frequent meals and snacks throughout the day, healing our relationship to movement and getting our body's movement in a way that's supportive and not disordered, that would really help. Yeah, those are a few things that come to mind in terms of like non-restrictive ways of addressing these chronic conditions.
Yeah. So just to kind of recap, what I'm hearing is it would be getting in some type of adequate carb throughout the day so that your body is not creating this intense craving for carbs because it's afraid it's not going to have it. So that could help you find more calm stability in terms of your relationship with carbs, while also pairing those carbs with foods that are known to slow down the absorption of sugar into your bloodstream. So you're pairing those carbohydrates with something that's high in fiber, high in fat, high in protein, and then getting in some movement, because that can help your body maintain, like help with blood sugar balancing. I'm also curious of like stress, so stress and like cortisol and adrenaline, like that can impact your blood sugar. So I'm also just thinking managing your stress would be something that would also be really helpful here. And something that I'm just sort of making a connection now, I'm curious of your thoughts, is like trying to remove foods and restriction and dieting, like that's really stressful, and feeling like your body is a problem and having a lot of negative body image, like that is also stressful. So that also, I'm curious, could by transitive property have a negative impact. So not only taking care of your mental and emotional health and managing your stress and getting enough rest, but like doing some body image healing could also potentially have a positive impact on those symptoms.
Yeah, totally agree there. I think the other thing that is important to note here is like, if you have improved body image and you're working on your relationship with your body, you're going to be more likely to want to take care of it in these kinds of ways. Because I think a lot of times too, when I have conversations with folks who are managing these conditions, they're like, they don't have a good relationship with their body, and like this idea of like self-care and like meeting their body's needs is just so foreign, because they've been operating from this like, I'm at war with my body, how can I control it and like fix it and all of this stuff. So it can be hard to transition to this mindset of like how do I just like care for my body and like feel like my body deserves this care. But certainly once we can like make our way to that space, maybe through some body image healing work, yeah, we're going to be more likely to engage in those behaviors that will support our bodies too. But totally too, to what you're speaking to, like taking your stress level down. I can only imagine that would be supportive for managing these things as well.
Mm. So a lot of people who remove food do so because they feel like they have gut issues or they have a lot of digestion issues. Maybe they've gotten the diagnosis of IBS. Often people are told to go on a low FODMAP diet. They're told to remove a wide variety of foods like, processed foods to gluten, to carbs, to sugar. And so there seems to be a really large overlap between gut issues and then people who have dieted or controlled food for the hopes of controlling their weight. To your knowledge, like why are they related? Do they influence each other?
Mm-hmm. Yeah. So I know like the relationship between those things is actually pretty wild. Like it's something like 90% or more. Don't quote me, I don't have a source, but something crazy like that, like 90% or more of people who have eating disorders, will go to the extreme there, have some sort of like gut issue. And the question is like, which came first, the chicken or the egg? Like, was it the restrictive diet that needed to be followed to manage the allergies and stuff that led to them kind of like spiraling to more restriction? Or was it like the restrictiveness that like developed some of these gut issues? And I think it kind of goes both ways. Mm-hmm. Yeah, I think that most people who are struggling, and again, this is a spectrum, so like it does depend on like how extreme your chronic dieting was or disordered eating, or certainly if you're in that eating disorder realm, but most people who have struggled on this spectrum have some amount of these gut issues. And it's not too hard to like make the leap there, right? It's like we are depriving, controlling, not giving our bodies in like our digestive tract enough, and therefore some things go awry. I remember from some of my like nutrition education way back when you are giving somebody like tube feeding, like that's in the hospital, like they're in these very extreme conditions where like they can't eat for themselves, so you're giving them food through a tube. Or if you're giving them like parenteral nutrition, which is through an IV, right? So that's bypassing the digestive tract and going right into your bloodstream. In those cases with the IV nutrition, and if you're going back to tube feeding or eating food, you need to really slowly reintroduce food because the gut is going to be really stressed out because it hasn't been used. So all of this to say, like, if you're not bringing in that consistent, adequate nourishment for whatever reason, whether it's intentional or not, there are going to be very real impacts in a negative way to your digestive tract. So again, it's not a hard leap to think about like, oh, like these food related issues are going to affect how we're able to digest and absorb our food, and it's going to occur along a spectrum and based on other factors like genetics and all the things.
So given that, so knowing that when we do restrict food, we're not eating adequately and consistently, you said like things in our gut can go awry. So essentially it's like our gut gets used to not being that active. It gets used to maybe not producing certain digestive enzymes. Maybe certain gut bacteria dies off because you're not feeding them the foods that they thrive on. And so things in your gut can start to change. And so your reactions to foods or your potential intolerances could appear to be more severe over time. And then when you do eat one of those foods that you're restricting, you're going to make this assumption of like, oh, look, see, I really can't eat that food. It causes me a problem, when it's not too far of a leap to say the restriction itself is what caused the gut issues. So then if that is the case, you did say this with switching from IV to tube feeding, but it's about a slow reintroduction of food back into the gut. And so would potentially be the same thing here, is that you're going to slowly reintroduce these foods to your gut so that it gets more used to having these types of foods.
Yeah.
The gut bacteria proliferates again. And when you're less stressed around those foods, that could also impact your gut digestion. So like, is that what that process would look like?
Yeah, I totally agree. And I think to some extent, like having some awareness that this is like kind of what's going on, and realizing that like the thing to do, like there potentially is gonna be some discomfort in this reintroduction phase, regardless of like the dose that you're giving it, but certainly like starting smaller and
Hmm.
with less would be better. Um,
Hmm.
this is also making me think of like another side effect of like restricting and disordered eating, and all of this is oftentimes like, yeah, just like your gut working slower, and that's going to lead to you experiencing like early satiety. And like sometimes that's going to mean that like you have to eat past fullness in order to get your body used to taking in an adequate amount of food. So I think just like having this knowledge that like, oh, like maybe here, like I don't need to honor this fullness, because what I really need is to make my body used to eating an adequate amount of food again, and that's gonna be some discomfort. Like these are the kinds of like nuanced pieces of intuitive eating that people don't always get. And then again, yeah, like realizing, oh, it's not the bread that's causing this discomfort or whatever else. It's the fact that I haven't been eating this and now I'm reintegrating it. And this discomfort is normal and has purpose and will lead to me feeling better later. So I
Like
feel like
it's
even just that now,
temporary.
yeah, it's temporary and it's healing, you know?
Mm, yeah. And I think like if you're sort of new to this, you could easily be alarmed by it and be triggered to go right back to the restriction, which if you're binging is right back to the compensatory behaviors that is resulting in you binge eating. So I think that this is like it's a really complicated situation. And obviously, like if you have the resources to get help, that could be so helpful to support you in working through the reintroduction phase, supporting you and working through the physical discomfort, reminding you that it's normal and that it's temporary. Meanwhile, also supporting you in the body image piece, because I think fear of weight gain plays a big role with everyone. So
Mhm.
so maybe this is kind of like a last question here to kind of wrap this up. And it's like I think it's a two-parter.
Okay.
So for somebody who has legitimate health issues that can successfully not eat certain foods,
Mhm.
and then somebody who has legitimate health issues who is sort of unsuccessful in not eating the foods that trigger them, what is the difference between those two people? And I'm curious, how much do you think diet culture, weight stigma, body dissatisfaction plays into the person who cannot successfully, I say successfully in air quotes here, successfully remove those foods?
Yeah, that's a really interesting question. I certainly think, I mean, I honestly, yeah, I think that there's probably like multiple factors going on to each person, right? Like partially, like it could go back literally to genetics and just like their body's responses to that kind of restriction. But I also think that there's a big part of it that is environmental. Yeah, I mean, again, it's bringing up a lot of the things we've already talked about. The person who's maybe like successful at being able to eliminate those things, maybe they're, they feel again, they're coming from that place of empowerment of like, I could eat those other things, but I don't want to. And maybe they're coming from a place of like really prioritizing satisfaction, and like they're not overly restricting, and they're not like, yeah, like restricting these things to the point of like not meeting their nutrient needs and like energy needs and all of these things. Whereas the person who is really struggling, maybe they're over restricting and they're not getting their energy needs met, and they're not getting their carb needs met when they cut out gluten, right? So like I think it's probably a case of like, are they getting enough? Are they coming from an empowered place where they're making a choice? Um, yeah, and is there that, like you said, like is there that guilt and shame going on around when they do eat the thing, right? Especially if it's a case of like there's some gray area and like they can eat sometimes, they can eat it sometimes and not always. Like, are you experiencing deep shame and guilt, or are you just like, I'm gonna decide to eat this? Like, I just want to enjoy it this time. It's okay if I have some negative digestive stuff happen later. Yeah, I don't know. Those are the things that come to mind for me as to like the differences between those two people.
Yeah. So just to kind of reiterate that again, what I heard was, so somebody who can successfully not eat something for health reasons would be, are they coming from a place of an empowered choice? Meaning, I can put this in my mouth. I'm aware of it. I'm choosing not to because I know it's going to make me feel X, Y, and Z way, and I'm prioritizing feeling really well. So again, that empowered choice.
Mhm.
I also heard making sure that you're not over restricting, meaning you're eating adequately and consistently and you're getting in your energy needs, like the actual need for food and nourishment that the body has. But you also spoke a little bit to satisfaction and pleasure. So if you are removing, let's just say gluten and dairy, because those are like everybody's favorite things to remove,
Yeah.
are you getting in gluten-free carbs? So gluten-free crackers, gluten-free chips. Are you getting in gluten-free bread? Are you eating potatoes? And then also, well, if you can't have dairy, are you allowing yourself to have dairy-free ice cream or dairy-free, gluten-free cookies? So there's some nuance there. So it's not just eating enough food, but it's also making sure that your needs for pleasure and satisfaction are being met within the foods that do work for your body. Otherwise, you're likely going to binge eat on those foods. And then that guilt and shame piece, that's like that last really big piece that you brought in of, well, how much of the diet mentality is at play here? Are you shaming yourself for eating the dairy-free ice cream? Well, that might make you binge eat dairy-free ice cream. Or have you given yourself unconditional permission to eat those foods and allow yourself to experience that pleasure? So those feel like the three really big distinctions of somebody who could successfully not eat something for a legit health issue.
Yeah, totally agree. Yeah, those are the things that come to mind immediately. I think there's even more nuance, I'm sure, but yeah.
Yeah. So anything else that you want to add here? We've gone all over the map here with medical
Mhm.
issues and health issues and restrictions and your career in the anti-diet space. Anything else you kind of want to add in on these topics for anybody listening?
I guess I would just highlight like finding that gray area when you can, because I think so often, again, we get stuck in these extremes of like, oh, like I can't have this or I can have that, right? It's like very like black and white. So like where can you find the gray area? And if you're working with a provider that's like giving you this long list of things that like you can't have and it's just like period, end of sentence, like never touch them or you're bad, like maybe find some, a second opinion or figure out how you can get support from somebody who's going to give you more of the gray area there. I think the more that we can kind of bring gray area and nuance into these conversations, the better.
Yeah. So just being more flexible and less rigid and not being so
Absolutely.
black and white.
Yes,
Yes.
totally.
So Kirsten, did I get it right?
Kirsten.
Kirsten, damn it. You guys, before we hit record, we had this whole thing about making sure I said her name right. So, I did not pass. Kirsten, like Kirsten Dunst. Damn it. Well, it's all good. I'm sorry. What are you most excited about in life right now?
Oh, I mean, I think that's an easy one. So I leave in 5 days for my honeymoon trip to Aruba. I got married like about 4 weeks ago. We decided to kind of take a little break in between, which I think was probably for the best. It was nice to kind of come back, settle back in. And now we have, a week trip to Aruba. And we're planning on doing like some surf lessons, snorkeling, beach days, having lots of delicious, yummy food and just like mostly relaxing. So I'm super excited for that.
Yeah, I hope you guys have an amazing time.
Thank you.
And that is definitely exciting. Congratulations on this new chapter.
Thank you so much.
Pimp yourself out. I don't think I've ever said that on the podcast before.
I'm like, do you always say that?
No, I've never said that before. I've probably been listening to Lauren Everett's on the Skinny Confidential too much. I went on a road trip yesterday. Where can everybody find you? If they want to learn more about you, they want to work with you, what are you enrolling for any offering right now? Tell us all the details.
Okay. So you can find me on Instagram at theintuitive_RD, like registered dietitian. My website is theintuitiverd.com. I have a podcast called Intuitive Bites Podcast with short little blurbs on all things intuitive eating, health at every size, and body image. Those are the big things right now for me. I do work with clients one-on-one, and I am kind of in rolling enrollment for that. So if you're interested in one-on-one work, you can find that on my website or on my Instagram.
Amazing. Kirsten.
You have to keep all this in here.
I will totally keep it in there. I'm so sorry. Shit, I'm gonna fuck it up again. Kirsten. Kirsten. I don't know what is wrong with me today. I maybe need another cup of coffee. Kirsten, right?
Yes.
Kirsten. Thank you so much for being on the Love Your Bod pod, and thank you for being so gracious with my name.
Of course.
Whatever that was.
Yep, totally good. Thank you so much, Cara. This was fun.
Yay. Thank you so much for listening to the Love Your Bod pod. I hope you got so much value out of this episode with Kirsten. Be sure to subscribe to my channel so you don't miss out on other value-packed episodes of the Love Your Bod pod.